Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. So, open heart surgery is a broad based term for all cardiac surgeries. It is what we call as conventional cardiac surgery, wherein we open the chest from the center. So, there is a breastbone right in the center of your chest, under which lies our heart within a protective cavity which is called the pericardium. So, if we go by the conventional method or the open heart surgical method, we have to break open the breastbone to enter and reach near the heart. Following this, we can perform any sort of open heart cardiac surgery which is required, ranging from pediatric surgery, which is surgery in small children for hole in the heart, to valve surgeries, which is replacement of heart valves, to or repair of heart valves, to bypass surgeries for coronary artery disease, even up to aortic replacements or any other surgery for the same. So, main necessity to open the bone is for access, and it is the time tested method of operating and has been done for the last 60 years, and there is no comparison to this method in terms of accessibility and ease of operating.